Lately, I have been receiving some questions about genital herpes. It is an emotionally charged subject for sure, especially for those who have been diagnosed with the infection. Because of the seriousness of the topic, many articles and videos have been created to shed light on what herpes is and how it's transmitted. So instead of rehashing the materials that have already been covered in great details, I want to devote this video to the subject of testing, as this is often the most confusing part of the discussion about herpes. Broadly speaking, there are 3 different ways you can test for herpes. You can either swab an active herpes lesion and culture it, swab a lesion to test for the DNA of the virus, or do a blood test to look for antibodies to the virus. How you decide which test or combinations of tests to do will depend on the situation, and they each have their own drawbacks. If you are currently experiencing symptoms of genital herpes and have a new suspicious rash, the most appropriate test to do is either a viral culture or viral DNA test. Both tests involve breaking the lesion open, if it's not open already, to swab and take a sample of the substance inside of it. Both can tell which type of herpes virus the person has, whether it is type 1 or type 2. If you can choose which test to do, the DNA test is probably the better one to go with, as it is more accurate and sensitive than the culture. The problem with the culture is that its accuracy depends on how many copies of the virus are on the surface that is being swabbed. If the lesion is small or is on its way to healing, there may not be enough virus to show up on the culture, therefore causing a false negative result. The accuracy of the culture is even worse when it's a recurrent infection. Only about 30% of recurrent outbreaks show up positive. This is why the DNA test is the preferred method of testing for acute active herpes infection. The DNA test is also known as nucleic acid amplification testing, or NAAT, with PCR being the most commonly used method. The PCR test is likely how you will hear it being referred to in the clinical setting. If you currently have no symptoms, you can still get tested for herpes, only this time you will need to get a blood test done instead of a swab. The blood test does not detect the presence of virus in the body. Rather, it is testing for the presence of antibodies to the virus. It is an indirect way of knowing whether or not you have been exposed and infected by the virus. When a person contracts the virus, the body mounts an immune response to try to get rid of it. And in any kind of immune response to an infection, 2 types of antibodies are produced. One is called IgM, and the other is called IgG. IgM is the first type of antibody produced right after an infection, but eventually disappears with time. IgG, on the other hand, gets produced a little later but sticks around for years. You would think that having these 2 types of antibodies can help us determine how long the person has had the infection. Unfortunately, this is not the case. IgM can reappear during a recurrent outbreak or sometimes even not show up at all, even though the culture of the skin lesion demonstrates the presence of the virus. As you can see, these characteristics can make it hard to interpret an IgM test and use it to determine timing of the infection. Not to bash on IgM, but it has 2 additional major flaws. One is that it cannot reliably distinguish between herpes type 1 and type 2. And because genital herpes is generally caused by type 2, while oral herpes, aka cold sores, by type 1, if you have a history of cold sores and happen to have an acute onset of genital rash, you might be misled into thinking that you have genital herpes when the test comes back positive. The other downside of IgM tests is that it can cross-react with other viruses in the same family, like chickenpox. So the false positive rate is quite high. For the reason we just talked about, blood test of IgG antibodies is really the way to go. Unlike IgM, IgG antibodies can be reliably identified as either type 1 or type 2. It does take a while for the body to generate IgG antibodies, sometimes weeks to months. So for this reason, it is generally recommended that this blood test be done 12 weeks after potential exposure. So in summary, if you have active skin lesions suspicious for herpes, the best way to get tested is through a direct swab of the lesion for PCR testing in order to identify the presence of viral DNA. If you have no herpes symptoms but may have been exposed recently, The best test to do is a blood test that detects the presence of IgG antibodies developed against the virus. I hope you find today's video informative and helpful. That's it for today, and see you next time.